Effective communication and teamwork is key to successful resuscitation. Let's watch the next two videos.
You called us about a depressed baby?
Yes, infant is singleton at term gestation with clear fluids. Mom is G1, P0, been pushing for about 3 hours. An hour ago, there was a decrease in fetal heart rate variability. The heart rate is now category 3. I've applied forceps. Infant should be out within a minute.
Okay, Cheryl, it sounds like this baby might be depressed, so let's go ahead and get all our equipment ready. We have suction, and we have T-piece and mask. Let's get a 1 Miller blade and a 3.5 endotracheal tube.
It's working for you. And do you need a stylet?
No, thank you. So I'll go ahead and manage the airway if you could listen for a heart rate.
Okay.
Okay, infant is out. Ready?
Okay, let's warm, dry, and stimulate. And suction warm, dry. Okay. Looks like the baby is not breathing.
Okay.
I'm going to go ahead and start ventilation. If you could listen for a heart rate.
I have a heart rate of 30.
Okay, the heart rate is low. I'm going to go ahead and ventilate. Keep warming and drying.
You think we need any extra help?
Well, it's been about 30 seconds. Let's listen for a heart rate again and see if that's improved.
Heart rate is still 30.
Still low. Okay, we're going to have to start chest compressions, and let's turn the FiO2 up to 100%. And I think we will need some extra help. Is there OB nurse Callie? Could you come here, please?
All right. Ready?
Hi.
This baby is very depressed. We need some more help. Could you please call for a nursery nurse and a respiratory therapist?
2 and 3 and breath. 1 and 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 2 and 3 and
They're on
breath.
their way.
1 and 2 and 3 and
Cheryl,
breath.
I'll help you with recording.
Thank you very much. Can you tell us when it's been 30 seconds?
Sure.
Okay. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2
Let's
and
listen
3
again
and
for the
breath.
heart rate.
Breath sounds are good.
The heart rate.
Heart rate is still 20.
Still low. Okay, we'll go ahead and intubate and continue chest compression.
Hi, I'm Celia. I'm a nursery nurse. Can I help here?
Yes.
My name is Yuri. I'm a respiratory technician.
Can you please put on the oximeter for us?
Sure.
Doctor, do you want me to help you with airways?
That sounds good. Let's check the CO2 detector. And if you could listen for the breath sounds and heart rate.
So we have changed color.
Okay. There's good sounds on the left. Good sounds on the right. Did you note the centimeter mark at the lip?
About
I'm going to put the
10.
pulse ox on
Okay.
real quick here.
I
Go to
can
9.
take
Okay.
from here.
Okay,
Alright.
great. I think I'm going to need some umbilical lines. I'm going to go ahead and set up for that.
All right.
Good.
Okay.
That sounds.
I can
Breath
start
sounds are
on that.
good.
And
And it's at 9?
I'm at 10 at the lip.
Okay. So I'm going to resume compressions. You ready?
Yes.
1 and 2 and 3 and breath. 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 1
We
and
got
2
pulse
and
ox
3
reading.
and breath. 1 and 2
Heart
and
rate
3 and
30.
breath. 1 and 2 and 3 and breath.
Pulse ox 25.
1 and 2 and 3 and breath. 1 and 2 and 3 and breath.
How old is the
1
patient?
and 2 and 3 and
How many
breath.
minutes?
How? Can you tell us, recorder? 3 and breath. 1 and 2 and 3 and breath. 2 minutes. 1 and 3 and breath.
Heart
1
rate is
and
still
2
low.
and 3 and breath.
Doctor, still low, 30. Doctor, do you want to give epi through the ET tube?
That sounds like a good idea. It's
Okay,
going to
we're
take
still
me a
getting
little
good
while to
breath
set up
sounds.
the umbilical line. So we'll need a dose of
Okay, choose this
endotracheal
one.
tube epinephrine.
Okay.
So that's
And the heart rate is the
0.3
same
to
as the
1 ml
oximeter.
per kilo
Okay.
of 1 to
So we
10,000.
Heart rate is not improving, still
This
30.
baby is 3 kilograms.
1 and 2
The
and 3
middle
and
range
breath.
would be
1 and 2 and
about
3
2
and
mLs.
breath. 1
Okay.
and 2 and
10,000.
3 and breath. 1 and
Down
2
to
and 3
endotracheal
and breath. 1 and 2 and 3 and breath. 1 and 2
you like me
and
to
3
give that?
and breath.
Let's go
1
ahead and
and
give
2
that
and
now,
3
but
and breath.
listen for the
1
heart
and
rate
2
one more
and 3
time.
and breath.
And make sure it's below 60.
Okay.
Pulse oximeter is still reading 30. Heart rate.
Heart rate is still 30.
I've got 2 mLs of 1 to 10,000 epinephrine for the endotracheal
Okay.
tube.
Okay.
I'm holding the tube. If you can help me disconnect.
2 mLs.
Epi is in.
Epi in.
Ready? 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. No heart rate response. 1 and 2 and 3 and breath.
continue with
1
chest
and 2 and
compression.
3 and breath. 1 and 2 and 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 3
I'm
and
almost
breath.
up with the
1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath.
Let me know when you're tired. We can switch.
2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2.
Okay.
Let me check and then we'll switch. Okay.
I'm gonna go ahead
Still
and
got breath sounds.
set up for an umbilical line.
The heart rate is still 30. Okay.
Heart rate is still 30. No response.
Okay, continue with
We're
chest compression.
switching.
Okay. Ready?
1 and 2 and 3 and breath. 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 2 and 3 and breath. 1 and 2 and 3 and breath. 2 and 3 and breath. 1 and 2 and 3 and breath. 1
Okay, I
and
have
2
a
and
scalpel.
3 and breath.
Careful.
Doctor, do you want to give another dose of epi?
You know, I'm almost set up for the umbilical line. How long has it been the last dose? Since the last dose of epinephrine?
1 and 2 and 3 and breath. 1 and 2 and 3
Recorder,
and
can you
breath.
give us that
Kelly,
information?
2 and 3
Okay, I'm
and
almost set
breath.
up for the umbilical
1
line.
and 2 and 3 and breath. 1 and 2 and 3
Okay,
and
stop
breath.
for 1 minute, please. And can you listen for the heart rate one more time? Okay, I'm at about 5 centimeters. I'm gonna go ahead and hold that. Okay, it's flushing. Okay, do you have the epinephrine ready?
1 to 10,000.
Heart rate is still low. I'm hearing about 30 beats per minute.
Okay,
Good breath sounds.
okay, let's continue with chest compressions. How long has it been since the last dose now?
So now probably about 1.5 minutes.
Okay, let's continue with chest compressions and ventilation.
1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and breath.
Okay, let's go ahead and
3
reassess.
and breath.
Okay, the heart rate is still very low.
Heart rate is low.
How are the breath sounds?
Good breath sounds. Equal on both sides.
Has it been about 3 minutes since our last dose of epinephrine? Okay, I'm going to go ahead and give a dose of epinephrine through the umbilical line.
I'm continuing chest compression.
This is
1 and 2 and
0.3
3 and
mLs,
breath. 1
1
and
to
2 and
10,000.
3 and breath. 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 2 and 3 and breath. 1 and 2
Okay, the
and 3
epinephrine
and
is
breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. 1 and 2 and 3 and breath. Looks like heart breath. 2 and 3 and breath. 2 and
Heart
3
rate,
and
heart rate
breath.
seems to
1
be
and
going up. Let's go ahead and take a listen and reassess now.
looks like
Some spontaneous breathing we're seeing.
heart rate is better.
Okay,
Heart
looks
rate
like
is about 100.
heart rate is 100, so we can stop chest compressions.
Good breath sounds. Equal. Okay.
Okay, so we'll continue with ventilation.
I will secure endotracheal tube.
Okay, I'll go ahead and hold this line in
I have
place.
some tape over
Do we
here.
have a tape? I got it.
Okay.
So endotracheal tube is secured. Let's listen again.
Okay.
If you
You
can
need to
hold
hold it
here.
just to be
So
sure.
yeah.
How's the heart rate?
Good breath
That's
sounds. Heart rate is
Okay.
good. It's about 100. Yeah, good breath sounds.
Okay, let's go ahead and get a ventilator ready.
Kelly, would you please call to the NICU, tell them that we're bringing the baby, we need the ventilator?
Okay. All right, let's go debrief.
All right.
Hi, we're the PEDS team. You called for assistance?
Thanks for coming. Actually, I have singleton and term gestation with clear fluids here. Mom is G1, P0.
Okay. Hey,
She's
can
been
you,
pushing for
turn
3
on
hours,
oxygen
and there was
something,
a
get it
decrease in
balanced?
heart rate variability approximately 1 hour ago. The heart rate is still low and is now category 3.
It sounds like
I
this baby
would
might be depressed and
Deliver the baby with forceps.
set one blade, a
Okay.
scope, and a 3.5 ET tube.
Okay.
I'm sorry, what did you say about?
I think the baby's coming
Bradycardia?
out. The baby's out.
Linda, the baby's up. Trying to stimulate.
Okay.
This baby's looks pretty depressed.
There's
Okay,
no
I
heart
think
rate.
heart rate's about,
No heart rate.
it's less, definitely less than 60. I'd say it's about 40. Let's give some positive pressure ventilation. Okay, I hear good air movement. Our heart rate is still, it's about 50. We're gonna need to start
It's
compressions.
actually 30. 30.
I hear about, okay, it's less than 60. We need to start chest compressions. Why don't I take over here and
Okay.
you can do the chest compressions.
1, 2, 3. 1, 2, 3. 1, 2, 3. Breath. 1, 2, 3. Breath. 1, 2, 3. Breath. 1, 2, 3. Breath. 1, 2, 3.
You gotta
Breath.
coordinate these. Coordinate your breaths.
Okay,
1,
trying.
2, 3. Breath. 1, 2, 3. Breath. 1, 2, 3.
Breath.
Okay.
1, 2, 3.
Breath.
Breath. 1, 2, 3. Breath. 1, 2, 3. Breath. 1, 2, 3.
Has it been 30 seconds yet?
1, 2. I don't know. 1, 2, 3. Breath. 1, 2, 3. Breath.
Let's take a
1,
pause
2.
and listen.
Okay.
Okay, go ahead. Go ahead.
Okay. It's still under 60.
Okay. Could someone please call for an extra set of hands? We're gonna need some help here. This baby's down. Go ahead.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2,
I
3.
think we're gonna need to intubate.
1, 2, 3. 1. Do we need someone here maybe to help us? 1, 2,
Yeah,
3.
I'd ask for help.
1, 2,
sorry,
3.
I didn't hear you.
Kelly,
Yeah.
Could you call for a doctor and a nurse to
Doctor and a
help
nurse.
us? Yeah, we need some extra help. This baby's
1,
depressed.
2,
Okay.
1, 2, 3. 1, 2, 3. I've got the
Hi, this is Kelly from
laryngoscope
Labor and
there for
Delivery.
you.
The
1,
doctor
2,
would like
3.
an extra doctor and a nurse
1,
to
2,
help her out.
3. 1, 2, 3.
OB or neonatal?
1,
Neonatal,
2,
please.
3.
Neonatal,
Don't
please.
you think you probably should intubate?
Okay, thanks, bye.
Let me-
They're on their way.
We're gonna intubate. I need an
Linda,
extra
I'll
set.
help you record, okay?
Okay, thank you.
Sure.
Here's
Okay.
that. And here's the.
The doctor wasn't available, so RT is here.
Oh, great.
Hi.
We've got a depressed baby, apneic and bradycardic, and I'm just trying to intubate here. Okay, I'm pretty sure we're in. Let's bag.
You want me to help?
I'm sorry, who are you?
I'm a nurse.
Oh, you're a nurse. Could you drop some epi, please?
Okay.
Baby's still apneic.
We check to see if
I think we're in a little far. Hold on, now we're at 10. Can you listen for?
Okay.
our CO2 detector's
I
turning
can
yellow.
hear it very nicely. Very good.
Heart rate's at 30.
But the heart rate's still low.
Okay.
1,
You want me
2,
to take over?
3.
Yes, that would be good.
1, 2, 3, 4.
And
1, 2,
our heart rate's
3.
what is our heart
1,
rate?
2, 3. I don't know. This thing's not on.
Still bradycardic.
1, 2, 3. 1,
So how much
2,
epinephrine
3.
did you want?
This baby
1,
looks like
3.
just about 3
1,
kilos.
2, 3.
Why don't you drop
1, 2,
2 mLs?
3.
Do you think maybe you want to
1, 2,
turn the
3.
pulse ox on?
1, 2, 3.
Yeah, could
Did you get good breath sounds? This is in
2,
pretty deep.
3. Yeah, I heard it pretty good.
Okay.
1, 2, 3.
I think I saw the cords when I
2,
put the
3.
tube in.
1, 2, 3. 1, 2, 3.
Do you have a pulse ox here?
1, 2, 3.
You want to recheck the breath
1,
sounds?
2, 3.
I'll recheck them.
1, 2, 3. 1.
We're in, but I'm not sure how deep you are.
You know what? I don't hear any breath sounds.
I heard them.
Pulse ox is on. I
The
guess
CO2
it's not
detector
picking
is
up yet,
indicating you're
though.
in.
It is? Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Is that better?
So how much epinephrine did you want?
2 mLs.
3.
Okay.
1, 2, 3.
I'm just gonna
Can you
pretend
listen
to
for the heart
drop
rate
the
and see? And
epinephrine here, so
I'm gonna
don't.
to set up for lines. If you can listen for the heart rate, I think you're gonna need to give some epi through the.
Okay. Have some epinephrine
Umbilical
here,
line.
2 mLs.
I don't have
What do you want
an
me to do
IV
with the
set up.
epinephrine?
Can you give that through the ET tube, please? 2
Here's
mLs.
some epinephrine.
It's still
Who
under
wants to go?
60. It's
Where's my IV set
Okay,
up?
epinephrine's in.
You want me to listen here?
Oh, sorry. It's okay.
Okay.
I've got a depressed baby
Okay,
and
we just put the epi in.
no
Well,
lines.
listening.
You want me to do
It's not
something
coming
else?
up. It's staying the same.
Okay, our heart rate is still low and our sats are low.
Yeah, so I'm gonna have to do compressions, I
Do you
guess.
want me to do something?
1, 2, 3. 1, 2,
Do you want me to
3.
take over compressions for you?
2, 3. I guess so, yeah, and I'll do the epi.
Okay. 1 and 2 and 3, breathe. 1 and 2 and 3, breathe. 1 and 2 and 3,
How much
breathe.
epi do
1
you
and 2
want?
and 3, breathe.
let's give
1
what we
and
gave
2
last
and
time.
3, breathe. 1 and 2 and 3, breathe.
2
1 and
mLs?
2
Yeah.
and
Oh,
3,
okay.
breathe. 1 and 2 and 3, 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 breathe.
Did you
1
get
and 2
epi
and
done?
3, breathe.
Yeah, the
1 and 2
epidose was
and
given.
3, breathe. 1 and 2 and 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 3,
Here's the
breathe.
epi.
Okay,
1
I
and
need to
2
put the
and
lines
3,
in first, so
breathe.
if you could
1
drop
and
it to
2 and
saline
3,
and
breathe. 1 and
the
2
line
and
in
3,
and then
breathe.
give
1
that
and
epi.
2
How much
and
epi
3,
did they give?
breathe.
Oh,
2
I
mLs.
gave 2
That
mLs.
sounds kind of high, but breathe. 1 and 2 and 3, breathe. 1 and 2 and 3, breathe. I trust the doctor's opinion of mine, so
See if I can find
breathe.
Drop-
1
here's some
and 2
flush
and
rate.
3,
Yeah, I
breathe.
got the
1
flush,
and
I'm
2
looking
and
for it.
3,
Here's
breathe.
a-
1 and 2 and
This is
3,
right here.
breathe.
Oh,
1
30
and 2
seconds?
and 3, breathe. I don't have a stethoscope.
Oh, here.
It still says 30 on the pulse ox.
Sounds like
I'm gonna
30.
transect
Do you want me
the
to
cord
time
while
the
you
30
draw
seconds
that up,
for
I
you,
can hear
Cheryl?
breath
If you're
sounds.
gonna-
That would be helpful,
Okay.
yes.
1 and 2 and 3, breathe. 1 and 2 and 3, breathe. 1 and 2
Can you
and 3,
stop for just a
breathe.
second? Okay.
1 and 2 and 3,
Here's the
breathe.
saline.
1 and 2 and 3, breathe.
And you
1
have that-
and 2
the
and
epi ready
3,
to go?
breathe.
Yes.
1 and 2 and
I've
3,
got 2
breathe.
cc's
1 and
drip.
2 and 3, breathe. 1 and 2 and 3,
of
breathe.
this.
1 and 2 and
Are you
3,
getting fatigued?
breathe.
Okay.
1 and 2 and 3, breathe. A little.
You want to change?
Breathe. 1
If
and
you
2
can just
and
pause
3,
for a second while I
breathe.
get this
Okay.
line in. Okay, got the blood return. Can I have the epi, please? Okay, I'm giving 2 mLs epinephrine. Epi in.
Heart rate's still 30. You want me to continue compressions? 1 and 2 and 3, breathe. 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 1 and 2 and 3, breathe.
Sounds like
1
the
and
heart
2
rate's
and
coming up
3,
here.
breathe.
Yeah. Oh, good. We're above 100, so we can stop chest compressions.
Do we have any spontaneous breathing yet?
No.
So just continue assisted ventilation.
Yeah, I hear breath sounds.
Wow.
Oh, oops, I just.
Oh.
Hold on a little bit.
It's okay. It's
Active
still.
heart rate.
So maybe we need
Yeah.
some volume. Could you draw, let's see, 30 mLs of normal saline, please?
Oh, the baby just gasped.
Do you still want volume?
Well,
I
she's
don't see regular
tachycardic, so you might need some
respirations,
volume.
though.
And she was down for a while, so it's... sats are 68. Can you listen again and see if we're still
Here's
intubated?
10 of the normal serum.
Okay.
Bring your
Just
breath
take her
down
back off.
bilaterally.
Are you okay?
Is your oxygen all the way up?
Okay, guys, let's go debrief.
Is it?
Let's go debrief. You're all done. Let's go debrief.
So we're all done?
We're done?
Okay.
Okay.
After attending to a delivery that warranted resuscitation, a debriefing must be facilitated to enable the team members to review and identify areas of conflict and improvement. Strategies on how to improve the identified issues are also elicited. The following video is an example of a facilitative and interactive debriefing.
We're going to debrief our scenario now. I want to start by asking you what you thought the learning objectives were for that scenario.
I think taking care of a very depressed baby where you need to engage in a series of steps because the first things that you do aren't working.
Okay.
I think clearly identifying when we needed to ventilate the baby and when that didn't work, that the compressions were needed and how to work together. And in this case, the baby was so depressed that we needed to carry out a full resuscitation.
Okay.
And what medications like epinephrine, when it's indicated and how it's administered?
Okay.
Yes. And I think like going through NRP protocol over and over again and doing your ABC, maybe some technical skills.
Yeah, those were exactly the learning objectives, to do adequate bag mask ventilation and to coordinate that with chest compressions at the appropriate time, to intubate the newborn, to place emergency lines, and administer epinephrine. So let's recap for a minute. You come into the room, you get a baby who basically requires ventilation and then also requires compressions. When did you call for help?
I think it was about the time that we started compressions that I called for help. And I think Cheryl at one point asked, do you want to call for help? And so that was a good thought, and we asked the OB nurse to call for some help.
Okay. And what kind of help did you need?
So I think we sort of knew beforehand that the potential help we could have was another nurse and a respiratory therapist, and certainly that was very useful because we were pretty fully occupied already, and more things were going to be needed, so we needed some extra hands.
Yeah, it was pretty clear after we intubated that the baby's heart rate was not immediately responding, and so we were going to need to move ahead to medication. So, and to get the added help of having the oximeter for heart rate was also something that would have been nice. So the assistant arrived just at the right time to be able to help us with that. And,
Good. So the team that came in as second responders, what kind of information or direction did you get from the people at the bedside?
I'm a respiratory technician, so when I came in, I saw that they're pretty busy with resuscitation, and doctor gave me very good, enough information for me to be involved. He told me that this is a depressed patient, the full term, and I wanted to help with the best I could do, so airways, my specialty, so I offered him my help, and I started doing ventilation together with Cheryl, doing chest compressions.
And I didn't have very much information going in other than a term depressed baby, and I knew that I was the second set of hands or third set of hands that was being called in to help. So I just knew that this was going to be a critical situation. I wasn't really sure what exactly had gone on. That's why I just introduced myself and said, what can I do to sort of jump right in from there, because there were a number of tasks that I could have taken on, but I needed to know from the team what was important to be done right away, and they quickly identified it, and I was able to just move forward and assist with the medicines.
Okay, so you were concentrating on drawing up medications? So at this point in time, what was everyone's roles? What were everyone's roles at the side of the bed? You were...
Yeah, we formed a good team, chest
Okay.
compressions,
Some
ventilation.
Okay.
Right, and I think even as I was sort of supposed to be leading the resuscitation, at one point I needed to focus on getting the umbilical line ready to give epinephrine. And there was a part of me that also wanted to focus on making sure the baby was doing okay. So it helped a lot that I could hear in the background somebody counting out the chest compressions, because I knew that that was still going on, so that I could focus on getting the line ready.
And Cheryl was very good in terms of reassessing, doing it. She was ahead of me all the time.
I noticed that as well. Reassessment of both heart rate and respiratory status were done on a regular basis. That was excellent.
Well, it was very helpful also to have the person who was doing the recording and helping us with the time, because 30-second intervals are just very hard to estimate on your own. You really do need a timekeeper.
Especially in an emergency.
That's right.
It seemed to flow very smoothly, though, and everyone seemed to get right into their role, when you don't always see that in a critical situation where everyone functions systematically in like a team. And it felt to me, I was less stressed because I knew I had asked what needed to be done, and I was doing that, and I felt like all the other needs were also being met, that we weren't really, we didn't need any more hands. We had the situation under control.
Good. Let's talk about the first dose of epinephrine. How was it given?
Through the intratracheal tube.
Okay. And does anyone remember how that came about?
I think if I remember correctly, it was very stressed at that time. And I was doing ventilation, and I was watching the heart rate on monitor on pulse oximeter, and time was going, and I wanted to help the baby, so I offered doctor to give epinephrine through endotracheal tube.
Right, so I think at that point I was pretty focused on getting the umbilical line ready, just because I know that the preferred route of epinephrine is by the IV route. So I wasn't actually even thinking about giving it through the endotracheal tube. So that was a very nice suggestion at the time, because it was going to take me probably a few minutes. It took me several minutes to get the line ready. So we gave the first dose through the endotracheal tube. And even though that didn't work, I think it was worth the effort.
The second dose of epinephrine was given through the umbilical line after you had placed the line.
Right.
Can someone tell me the difference between those two doses of epinephrine?
So the dose through the endotracheal tube is higher. It's a range of 0.3 to 1 ml per kilogram. And we were estimating 3 kilogram baby, so we gave a sort of a mid-range dose through the endotracheal tube. And then the umbilical line dose was lower, 0.1 ml per kilogram.
But one thing, since I was there with the baby, is I noticed that they were being very careful to repeat the dose so that there was no confusion, because we know with the two recommendations that is a risk that could happen. So it was clearly that when we were going to give it through the ET tube, then obviously had to disconnect the TPs from the endotracheal tube, that we repeated, what was being given and coordinated that. So I think it went pretty smoothly, if I recall correctly.
And I like to repeat it also, I like to say it out loud, because sometimes I'm not sure of myself, to make sure that everybody agrees with the dose.
It's a good idea to repeat the exact dose along with the concentration, which I noticed that you did, because there are two concentrations of epinephrine. So repeating both parts of the medication are important parts of closed loop communication when you're giving a medication as important as epinephrine. Based on your experience with this simulation, does anyone have any points that you're going to take back to the bedside next time you take care of a baby in a similar situation?
Well, one thing that impressed me, it did get fatiguing. And I think that I could see where, again, we need to continue to communicate, and perhaps if we have adequately skilled people, is when the compressions are so critical, and this baby was not responding, that maybe it's good to switch positions and take a break, because I think the depth of compressions and the rate and the coordination are all things that you can easily get fatigued. And so that's something I will appreciate more, after this scenario.
Anyone else?
I just liked the organization of it. I felt like when I walked in the room that the doctor was, I knew who the team leader was, and there was a role designation of what everyone's responsibility was, and I think it'd be a good idea in the future to divvy up responsibilities, if possible, before the baby's born. So if you have a clear understanding of what you're supposed to do, then you can anticipate more quickly, I think, how to move forward with the resuscitation.
Okay.
And for me, this experience, when everyone was thinking out loud, as a backup team, I knew exactly what's going on. I think everyone knew what roles were. So I think it was, for me at least, it'll be the most valuable lesson.
Yeah, and I think I really appreciated everyone, how they were suggesting different things or asking questions in really a very helpful but non-threatening way. And in a highly stressed situation like that, I think I know I can't think of everything, so I appreciated everyone's input.
And I think everyone felt equally respected in the team, so that even though we have a leader that's important, I think we all realize we all need to work together to carry out a successful resuscitation. So.
Good job. You ready to go back in the simulator?